Good morning, everyone. My name is Cornelia Stevens. I'm the Executive Director of Top A Learning Centers in Wichita, and I have the honor and privilege of serving as the chair of the Early Childhood Recommendations Panel. We would like to thank you all for joining us this morning. And for those of you who are on the panel, thank you for dedicating your time to participate in our meetings and really help, guide and shape our state's early childhood care and education system. So today's meeting materials are posted on the panel meetings website, which is webpage on the Kansas Children's Cabinet site, kschildrenscabinet.org. Panel members, we ask you to clearly identify yourselves when you begin speaking. You can raise your hands if you like to show that you're ready using the raise hand feature, or you can just, that's actually probably easier. That way, Lindsay and I can kind of keep track of anybody that would like to, have comment. For today's agenda, this is, there you go. For today's agenda, we are going to first approve the this month's agenda. We're going to approve the July meeting minutes. We'll have, do we have anybody that would like to speak on the open forum? So we have nobody that's interested in speaking today, but we will provide more information on that should anyone want to share information with the panel. I will provide an update on the Early Childhood Transitions Task Force meeting that was held yesterday. We'll have an update on the developmental health actionable solutions and the early childhood integrated data status update. We'll have an overview of group membership on all of the All In for Kansas work groups that everybody kind of volunteered to serve on. And so we'll kind of go over the membership of each one of those groups. You'll have opportunities to talk about bright spots. So start thinking now about anything that you want to share regarding your program, things that are happening in your community that you just want to share with others. I think it's always great to be able to hear about the wonderful things happening in Kansas. We'll talk about upcoming meetings, and then we will adjourn and break out into our work groups. So we will actually have work group meetings today. And so this will be the first of the work groups for the new year. And so we're looking forward to hearing updates in the next meeting from our work groups. So again, panel members, please clearly identify yourself when you begin speaking to make a first and second motion. So the first thing, Lindsay did send out the August agenda. So may I have a motion to approve the August agenda as presented?
This is Natalie McLean. I'll make a motion to approve the August agenda.
Thank you. May I have a second?
This is Saldana Chestnut. I second.
Great. All those in favor, thumbs up or say aye. Any opposed? Perfect. The July meeting minutes were also sent out to the group. Do we have any modifications or changes to the July minutes? If none, may I have a motion to approve the July minutes as presented?
Leanne Neal, I move approval of the July meeting minutes.
Perfect. May I have a second?
Karen McCrory, I second.
Great. All those in favor, thumbs up or say aye. That is great. Any opposed? Okay, perfect. Minutes are approved. So for those who are watching via live stream, we do provide opportunities for individuals to come and either present information regarding any subject matter that you think would be of interest to us as a panel, and or you can send something in writing that you would like to share with us. And so we do encourage you to submit your comments through the Kansas Open Forums comment form by 5 o'clock the day preceding each meeting, so that we can actually have information in advance or whatnot for the meeting. So if in fact there's information that you would like us to know more about, if there's something that you're doing, if there's something that you think that we should be considering along the way, we encourage you to please submit comments. You can either again speak in person or via Zoom, in the meetings, and or submit information in writing. So we do encourage you to do that if in fact you have anything that you'd like to share with the panel. So the first thing is to give an update on the Early Childhood Transitions Task Force. So I serve as the co-chair of the Governor's Early Childhood Transitions Task Force. And for those of you who may be new and are trying to first off, what is she talking about? To give a little bit of a brief history. In January, Governor Kelly signed Executive Order 2301, creating a Early Childhood Transitions Task Force, which tasked the group with creating the framework of a model single agency structure that would basically consolidate initiatives and funding of various early childhood programs that really benefit Kansas children and families into one new cabinet level position. And so what we're doing is trying to figure out, okay, what would this look like for the state? Part of the reason for this is because things are very, very fragmented across the state. You have to go to multiple agencies if you're a family trying to access services, or if you're a provider who is needing support. And what she wants to do is to be able to streamline systems in our state so that it is easier for Kansas children, families, and providers. There are several states who have actually already done this and created single agencies for early childhood programs. We had, in our last meeting, we actually had presentations from Missouri and from Colorado, which were two states that did that. And so that we can kind of get an idea of what worked and what were the hurdles, what were the lessons learned or whatnot from states who have done that before, as we try to figure out what we want to look like in Kansas in terms of our model and what we do. There were two tasks that were first assigned since our last meeting that happened, I think it was in May. The first was to create a summary of everything that has happened to date. That summary is available if you go to the governor actually on her page has a Early Childhood Transitions Task Force landing page where you can actually see a summary of the action items that have happened so far. But the second was to have community engagement tours. It was very important to the governor that as we are looking at creating this new agency, that we really hear from the people that are going to be impacted by the decisions made. So we had 9 community engagement sessions. Of these 9 community engagement sessions, we also added a virtual session for anybody who wasn't able to make it during the day to the community engagement sessions. As a whole, we had over 500 Kansans that participated, and that was amazing because, we didn't know whether anybody would come, and that was absolutely not the case. What we talked about yesterday in our meeting was, first off, what were the lessons learned? And it was quite interesting because, the hope was if we go to 9 different parts of the state that we would hear about situations in Western Kansas that might be a little bit different than things here in Wichita, for example, that might be different than things in Kansas City, Kansas. And, what we actually heard was a lot of consistency. We know there were, of course, some community issues that might have been, specific to that area, but there was a lot of consistency and the same message happened across all 9 sessions. The things that were identified that were constant or that were things that were definitely elevated, first was that there needed to be some improvement in terms of licensing. The current process is slow, cumbersome, and hindered by the fire marshal, outdated security codes and response rates from the fire marshals. Providers don't really know where they are in the process when they need to get approved. In rural areas, in-home providers feel less inclined to go through the application process due to the time and effort that it takes. So that was the first thing that was elevated, that as we are looking at restructuring our system, we need to look at the licensing process. The second was a lack of workforce. Some care facilities that shut down during the pandemic never reopened. Low wages make recruitment and staff retention very difficult. Many providers think that there are too few child care training programs in their areas, and the antiquated public perception of early care professionals due to some government officials and different attitude towards the field, meaning that, people still see us as child care providers. They don't understand that we're actually shaping the individuals that are going to lead our future, right? And that we're actually educators. And so there seems to feel that there's a feeling that maybe there's not the same respect for early childhood professionals as they are for K-12 educators. And the inadequate workforce is has serious impact where one person that calls in sick causes a domino effect, and you have to shut down a classroom, because if we have to have two people in a room, depending on ratio, and if one person calls in sick, you can't open that room. And so that workforce issue is actually creating a significant issue in centers being able to keep rooms open. The next was affordability. Childcare comes with a high cost of both receiving and providing care. To many respondents, the cost of care still feels high, even with state subsidy. Some describe the situation as a donut hole for middle-income families, and that they make too much to receive subsidy, yet the portion of their pay devoted to childcare is burdensome. Meanwhile, providers describe childcare as a low-margin business where it's difficult to keep their lights on and the doors open. And providers struggle on, do we raise rates, even though we know that families are already paying, a significant amount of their income towards childcare. There were some who, talked about the reality that there are, two-parent households where they make a decision to actually keep one person home because the majority of that person's pay was going to pay for childcare, and it made more sense for them to stay home. And so affordability was definitely the case. Was again risen to a priority. Next is accessibility. Many families reported that they don't have reliable transportation to seek care due to lack of a vehicle or a long distance in travel time to be able to get to an affordable child care center. Geographic boundaries are not always aligned, which makes smooth transitions between services difficult. Transportation between the school system and childcare is not always available. Similar feedback was received from early childhood professionals. Long travel time reduces home visitors' capacity to work with more families. And so, because this is not about just childcare, this is about all services and programs that impact children and families. And so for home visitors, there's definitely a challenge to work with more families due to travel time. There's also language challenges and immigration issues that prevent families from getting the services that they need. Next was system navigation. Parents from all 9 locations made a point that it is difficult to navigate the various programs and find the information that's needed. You can't easily get on a website and actually get to what you need. And sometimes when they call and ask for supports, the employees don't often have the correct information to guide them through a very complicated system, because not one single agency handles all aspects of a service that's needed. Sometimes there's multiple programs, and that can be somewhat difficult for families. There were some inefficiencies that were noted in terms of how things are managed between various programs, but also recognition that there has been increased collaboration over the past couple of years between state agencies. And so we were glad that people are recognizing, that state organizations actually have really improved in terms of how they're collaborating and working together to be able to better support our children and families and improve systems. And so we were glad, to see that though the 500 respondents all recognize that. Of course, there is a need for more funding, and the restriction of funding makes it difficult for communities to provide services to families. Definitely more resources and support to be able to fund special education, and definitely a growing need for mental health services, which are largely unmet and underfunded. And then the last was the social stigma that's assigned to receiving benefits. Some families choose not to seek help because of a perceived social stigma around receiving government subsidies. They don't want professionals coming into their home, risking removing their children. And by and large, when professionals come into your home, their task is not to remove your kids, but that's what a lot of people fear. And so they don't want people coming into their homes. And so doing something to be able to fix the stigma around, childcare subsidy and what that really looks like is something that we have to do something to elevate as we're trying to figure out, again, what our system needs to look like. We did have a lot of things to celebrate. We have, school districts who have really kind of stepped up and are opening, more preschool slots. Some are now serving 3-year-olds and partnering with community-based programs, in order to be able to expand access. We have more business support across the state, and public-private partnerships are being formed, in order to support early care and education. Nonprofit organizations, entities such as Child Care Aware of Kansas and United Way have been a positive force in providing guidance and navigation and resources. There has been, again, as I mentioned, the collaboration of the state agencies, but the biggest thing that we celebrated is the professional passion and pride of the work that was done, that we do. Early care and education professionals truly believe that the work that we're doing makes a difference, not only for the current environment that we're in, but for our future. And there was definitely passion that was celebrated in these meetings, and that you can see in all of the written comments that we had from those that attended. So now what we have is, we reviewed all of the feedback that we got from our 9 community engagement sessions and began conversation about what would a single agency look like. What I appreciate in terms of the task force members is that we were willing to have even the difficult conversations. There is a reality that it's not going to be easy to create a single agency, that there may be state agencies that might not want to give up certain parts of, what they do. It also has to be approved by the legislature, and there may be some that might not be, in favor of big government, creating some big structure or whatnot. But we also know that there were a lot of things that need to happen and some things that needed to be fixed now, not to wait for like a 2 or 3 year plan, but things that actually need to be addressed now. And so there are work groups that are going to happen as a result of yesterday's meeting, where we're going to talk more about specific issues in terms of implementation, also perhaps identifying what needs to happen now, what needs to be in place before something like a single agency can go live. What do we really need to make sure works? And what are going to be the measurements that we need to be able to know that we did it right? That we don't want to just build an agency and then by all of a sudden, by default, the unintended consequences that we've actually made things worse. We don't want to do that. And so where are the different pressure points? What are the things that we're going to look at where we're going to pause and see, okay, is this working? What needs to be changed? And how do we know we won? How do we know at the end, that things are better for children, for families, and for providers? And so those are the things that we're working on now. We'll have a next meeting in October and then a final meeting in December, and then have a recommendation to give to the governor in the beginning of January. And so I look forward to giving you further updates as we move along in the process. Any questions, thoughts, comments? Okay. All right. So if none, we will move on to the next part of our agenda. So we will have Rachel Gardner, who is going to give an update on the Developmental Health Actionable Solutions Opportunity.
Thank you, Cornelia. Again, my name is Rachel, and I am a project coordinator at CPPR. And I'm here to share an opportunity, if you will, for you to take back to your local communities. To provide just a little bit of history, back in the fall of 2022, as part of the All In for Kansas Kids strategic plan implementation efforts, CPPR conducted a survey to learn about how Kansans understood the topic of early childhood developmental health, screening processes, and available resources. Nearly 1,500 families and providers across the state participated in that survey. And the results of that survey were then collected as a first step to improve existing awareness efforts around developmental health, and then to prioritize new initiatives and education. The themes that emerged from that feedback really helped support the next step, which was the virtual developmental health family engagement sessions that were held just this past spring in 2023. And the purpose of those family engagement sessions was to elevate family voice, to increase parent knowledge of what developmental health is, and for parents then to work together to generate small actionable solutions that could be implemented in communities across Kansas to improve developmental health experiences for their families. Some of the highlights from those sessions included all regions of Kansas were represented, which was amazing. There were 6 independent virtual sessions, and 5 were facilitated in English, and 1 was facilitated in Spanish only. And there were 93 participants for those 6 sessions total. And these family engagement sessions, there were so many ideas that were generated over the course of these sessions. And these actionable solutions were compiled and categorized to help create kind of a post-session survey, if you will, where those family participants voted on what would be most impactful to Kansans to least impactful to Kansans. And so what we've discovered in that follow-up survey really kind of categorized them into 3 categories. Technology, process, and connection were really the 3 highlights from that feedback. And some solutions for technology, besides having that one family hub, that one trustful place where families can go to find that information, were things that people could do in their communities, such as an app to access local developmental health resources and information, or possibly an opt-in text service for reminders of upcoming screenings or milestones, or maybe physician visits. As far as the process, really trying to discover ways of improving that process of accessing the developmental health information. A group really came up with a great idea that having a family resource kit that they would have access to that included age-appropriate tools or toys for in-home use to really not only create that family bonding time, but also helping support that developmental growth in their children in the home was a great idea. And then finally, connection, ways to get connected and stay connected included local opportunities to learn from experts in the field, as well as increasing awareness of local supports and services. And here you'll see there are some other actionable solution ideas, a few that I'll pull out real quick, just family health fairs or local play groups, and also culturally competent information and resources really came up a lot. And so just really identifying what's needed in your community and making those resources available. So there is an article on the All In for Kids website under the Community Spotlight section. And Sarah O'Keefe from CPPR did a lovely job of creating these graphic recordings of English sessions, and then the Spanish session as well. So please go and look there. There are tons of ideas that you could take back to your community. And so we at CPPR have partnered with a couple of agencies across Kansas on a few solutions. And you can go to the next slide, please. Thanks. So there are obviously dozens of ideas that are still left. And I think what we were asking for you today is to consider taking some of these solutions back to your community and discuss how they might be integrated to improve developmental health experiences in your area. CPPR does have some backbone support availability if you are interested, and also some funding if that is needed. So if you go back to your community and decide this is something that you want to do, please reach out to me at rachelgardner@ku.edu, and I can help set all of that up for you. And if there are any questions, please feel free to ask away, or thank you for your time today. Oh, I do see someone's hand up.
Yes, Michelle.
Yes, this is Michelle Adams with DCF. I was curious how this work interacts with Help Me Grow's work and that connection.
Thanks. That's a great question. And I also work on the Help Me Grow work as well. And so we are really trying to connect the two. This originally started from the ASQ screenings and some of the feedback that we were getting from the participants in the ASQ screenings, that there was a lot of lack of knowledge or supports or education in their communities. And so that's when these sort of developed, and it does really fit well with the Help Me Grow work as well.
Good questions. I was curious about that connection as well. So thank you for that.
You're welcome.
Yeah. Any other questions? Okay, if none, thank you, Rachel, for sharing information, and looking forward to further updates as things move along. Next, we will have an update from Emily Kaufman, who is going to share about the early childhood integrated data.
Yes, hi, thanks, Cornelia. Yes, my name is Emily Bertels-Kaufman, and I'm here to talk about something that is at once very powerful and at times very boring, and that is data. We all have it, we all love it, we all hate it. We are working on a project that seeks to integrate data and pull integrated data across different agencies that support children in Kansas. Specifically, what we're trying to do with this project is provide a distinct count of children who are served by various services in Kansas that span different agencies. So we are seeking to gather that data and then display it in a visual way in an accessible location for folks to access. So for this particular project, right now we're focusing on a few, the biggest systems serving children, and that's childcare, public pre-K, Part B, Part C, and home visiting. This is a new project that hasn't been taken on in Kansas before. So as a first step, we are gathering this level 2 kind of aggregate data from sources that are already public, but maybe not pulled together in one place, and then working with agencies to gather data that they collect that is aggregate. So we our approach here is to work with folks. Some folks who are on this call have supported this project to gather that data and then refine it and put it in a dashboard in a visual way that's not overwhelming or intensely data focused. It is a very pretty dashboard to see this information represented. This project came from the Early Childhood Data Trust. It's a group of folks who have committed to share their data and for projects that benefit the state. And there are representatives from from 5 key state agencies who are serving children. So this project is being done on behalf of the Data Trust, who serve all of Kansas. The approach that we took to put this project into motion is that in January and February, we did conduct quite a few discovery sessions with key folks who are data stewards in their agency, who are program experts, and could give us feedback on what they hope to see in a dashboard, how they collect their data, what their data represents, so that we could then collect that across the different agencies and attempt the best we could to standardize that. As you can imagine, that was a difficult process. It was hard to combine like with like and be able to represent a cohesive set of data from different entities. We did that in May, and are continuing to do that as data comes in from our agency staff. We have started to process the data here in June and continue to do that as well through September. And as we have processed the data, we have also at the same time started to develop the visualization. So that has technical aspects that are difficult to transform from the data to something that is easy to digest and easy to see. So we did have some feedback sessions with folks to give us, ideas of what they would like to see, and to try to help us represent the data that we've collected appropriately. The next step with this project is that after we've collected the data, we've transformed it, we've tried to standardize it across, we will return to agencies to have them make sure that we have transformed it appropriately. So we did not change anything drastically. It still represents what they sent to us. We will have some final adjustments to the dashboard itself, the pretty things, the colors, make sure the data quality is appropriate, and then have all that fun light reading of technical documentation for the folks who really love the data. We'll do that in September to November. And then we will publish this dashboard on the cabinet website around December. We do have some exciting engagement opportunities to continue this momentum of integrated data in 2024, and we're calling these the data summits. We do hope to have folks who have participated in this project specifically, but also a wider audience, specifically talking about data, how it's collected, how it's used for good, barriers to collecting it and presenting it, and that those will come in 2024. So at this time, I'll go ahead and open it up for questions as well. Did put my our contact, the project contact there if you have more questions after the meeting.
Perfect. Anybody have any questions for Emily? Aldana?
Yeah, hi, thank you, Aldana Chestnut. Just to clarify on who is the target audience for the data summits?
That would be for next year. It would be really anyone who works with data in their agency, who uses it, collects it, seeks to tell a story with it. So that's a good chunk of folks. So we're hoping the more the merrier, essentially. We'll plan to kind of have some communications out in various places in the next year or so around how to join those.
Perfect. Karen?
Sorry. So I'm curious, was Dr. Lynn Schwefferman from WSU a part of your data group discussion?
Yes, she was. Early on, she was a part of the discovery sessions. Yes.
Awesome.
Yep. Similar work there.
Yeah, I'm the
Oh, sorry.
ECBG data person fan in my neighborhood. So I look forward to this work.
Yay! We call you a champion. That's what our brother calls it. Champion.
Marites, I think we saw your hand.
Hi, Emily. This is Maritas. I'm just trying to understand what what are the integrated data that are being collected?
Yes. So this is our first attempt again. So we're really going with the basics. We're doing demographic information that that we could find that went across different data sets. We're doing program information and numbers for different programs, and that's the biggest piece. So the demographics is really the biggest aspect, but the number served as best we can get in a distinct way will be the other big piece.
So in what you're stating then is that, so whereas we can go to Child Care Aware of Kansas and see the number of kids with child care, and we can go to DCF and see the number of kids that may have subsidy, and we can look at KSDE and see the number of kids in preschool, that this will actually be something where it combines all of that. And we have all of that data in one setting, in one website.
Correct. That's the dream, and that's the goal.
This is Maritas again. I love the information, Emily. I do have a follow-up question. Is this data going to be updated annually?
Yes, it is. We have planned for 3 years. So it won't be updated in a live way, obviously, but we'll return to the agencies each year to request a new updated data set. So we'll be back in about next summer. It'll be updated again.
Thank you so much.
Mm-hmm.
Any other questions? Okay, well, if none, Emily, I am a data nerd, so I am excited to see this as one who has to navigate all of the different websites. It'll be interesting to have it all in one place. Karen, I'm like you. I love looking at the statewide data and what it looks like in terms of the block grants, and to be able to have this, for grant writing, but also in showing the need, showing impact, all of that is going to be very helpful, but quite a task to take on. And so that'll be so starting small is good. Let's just start with children in programming. And then grow from there. So that's exciting. And so looking forward to being able to utilize this system once it is up. Thank you. Okay, so moving on. We have 4 different work groups that panel members have been assigned to. You have each received an email from Lindsay with information regarding your work group and the work groups that you were assigned. The first group is family-friendly workplaces. I will not go through all of the names of everyone. You can see your name there, but you should have received an email with information on the group that you are on. Work group 611 is compensation and benefits, and you'll see the work group members there. The next work group is 712, which is zoning. And we do have a subject matter expert that is going to be on that work group with zoning, and to be able to help guide and lead to that, provide info in terms of that the conversations that are happening. And then 615, which is recruitment and retention. And we also have a subject matter expert who will be a part of that group as well. So again, all work group members should have received an email from Lindsay letting you know what work groups you were on. And so today is going to be our first work group conversation. But before that, we're going to go on ahead and have an opportunity to hear from you. And so when we started our meeting, we talked about bright spots, and we wanted you to think about, things that are happening within your organization, within your community that you want to share. And so who has bright spots that you would like to share this morning?
This is Dana Stanton. I am the Child Care Program Specialist for the Northwest Kansas Economic Innovation Center in Hayes. And I would like to share that this last month on July 31st and August 1st, we had the first annual Northwest Kansas Child Care Provider Conference. We had about 140 child care providers that received 16 hours of KDHE approved training to fulfill their professional development requirements. We fed them breakfast, we gave them lunch, and it did not cost them a penny. We worked with Child Care Aware, we worked with Casito for our presenters and for some reimbursements for mileage and things like that. But it was a really big success, and we're looking forward to doing the same thing next year.
It sounds awesome. Very good. Very congratulations. Congratulations. Eldana.
So actually, I wanted to call out a meeting that Cornelia and myself and several others attended yesterday. Senator Marshall had convened a group of childcare leaders to discuss the issue of childcare. So it was just, I thought it was a really good meeting. I wish it was a little bit longer and we'd had a little bit more ability to respond to each other's information that was being shared, but I felt at least it was a good start and it was good to have the senator's ear even for just a few minutes.
Agreed. Thank you for sharing that. Jarvis.
Good morning, everybody. Jarvis Dolman, Section Director for Child Care Licensing for KDHE. Many of you know we are working on our regulation update. As of late last week, we wrapped up first 3 categories. So all that internal review and stakeholder feedback has been done. And we've gotten our drafts looked at by our legal contractor, and those drafts have been moved up to legal for review. So that's really great for us. It's been a 30 hours a week, plus we've been meeting, going through those regulations. So we've got those all wrapped up for the most part. Our last category, and we just come to this decision earlier this week for category 4 for our school age programs and drop-in programs. We are going to push through some of the big changes for those, but what we're going to do is immediately wrap around and meet with our school age and drop-in program partners and have a comprehensive review with those entities and see what we can do to make things better and break barriers for those program types. So, and then a little bit on statistics for licensing. So since September, our program we have increased capacity, approximately 2,900 slots across the state. Back when I began back in September, we're averaging about 17 apps a month. We were starting the process. Now we're averaging about 50 apps a month that we're able to, start getting processed through that process. And I don't know if many of you have seen our online electronic waiver now for fingerprinting. That has really helped the fingerprinting and background check process out for us tremendously. We were having issues getting those waivers back for us to process background checks and fingerprints. Now that we've moved to this new online waiver, it's allowing individuals who do get fingerprinted to have that waiver sent in immediately as soon as they sign that waiver, it comes to us rather than having to mail it in. So a lot of bright spots in CCL. We're proud of the work we're doing. So just wanted to pass that on to everyone. Thank you.
Well, thank you. And I love seeing the increased numbers of applications that you're seeing, and thank you for all of the work you're doing. I know it's the definite labor of going through all of the regs and updating all of that, but looking forward to see where we land on that. Martez, I saw your name. I saw your hand go up first before I saw the little emoji. So you're next.
This is Maritas. I just want to share, most of you are aware of our partnership with the Kansas Early Childhood Developmental Services. The Kansas State School I'm transitioning from one job to another, so I'm mixing all my ideas. The Kansas State School for the Blind is able to provide support to 29 infant toddler programs network across the state year-round at no cost because of our partnership with the Kansas Early Childhood Developmental Services. So we also provide information if any of your centers have any kids that you're serving with visual impairments and you need accommodations our partnership is with Part C. But if your team like to have just like a generic in-service about what do we do with this or what does it look like or accommodations or adaptations that your center may adapt, give me a call.
Thank you. Thank you for that. Tanya?
On the subject of data, we had our community needs assessment results earlier this year, and from those results, we were seeing that our early Head Start families were struggling to get to school because of transportation. So I went and spoke with the Wichita Transit, and we just piloted a program where all of our families can receive free bus passes for their entire family. And it's not just to attend school, it's to go anywhere in the city, whether it's the library, the grocery store, doctor's appointments. And so we're piloting that, and it's 100% free for all of our families. And it was really, truly data driven. And so we are excited for that and those families.
That's very cool. Very good. That's exciting. Very exciting. Nichelle.
Yes, this is Nichelle Adams from DCF. I wanted to mention that we have a PEBT program, which is supplemental food assistance for school-age children that receive free or reduced school meals. We are related to the child care PEBT. Those are being issued right now from the 15th through the 24th, depending on the children's last names. But we will also be issuing, they're called summer EBT programs, but they'll be issued in January of 2024, and it'll be an additional $120 per child that are on those free and reduced price school meal lists. So that's happening.
Very good, very good. And so Nichelle, how would an individual or someone access that?
So that information is on our DCF webpage.
Okay, so they just need to go to the website and, okay, perfect. Okay. Tanya?
Hello, Tanya Kane with Child Care Aware of Kansas. I just wanted to let everybody know that we have launched our 2023 supply demand report, which does also show, like Jarvis said, the increase in childcare programs for the 2023 year. And to piggyback on that with some live data numbers, if you're not aware, under our website, under the research and it's the research and the data page. If our point in time with all the maps, but if you click the full data report for the state of Kansas, that is live data out of our database for the whole state of Kansas. And that will also show you that you can see as the Kansas numbers from 2022 are rising for the number of programs in 2023. So it is neat to be able to watch those, which does also show the work that KDHE and the everybody is doing out with the providers to increase our numbers. So
very good, very good. Karen?
I'll piggyback on her data on her website is extremely useful. I serve 5 different counties and 6 school districts. So we have an administrators gather 4 times a year, and we use that data to present to the administrators and connected it with staff retention for their elementary and high schools, and have encouraged districts to open. Cumulatively, we have 3 new group homes and 2 districts partnering with childcare facilities, really, and thanks to the data we were able to present. So very powerful, very useful.
Amazing bright spot so far. Does anybody else have a bright spot to share?
This is Brenda Bandy with the Kansas Breastfeeding Coalition. And I just wanted to share, it is Happy Kansas Breastfeeding Month. The governor proclaimed August Kansas Breastfeeding Month. It is also National Breastfeeding Month. And we were very honored to have Jarvis Dolman there at the proclamation signing. So it was nice to stand alongside him and our other partners as well. And I just received word from Child Care Aware of Kansas a few days ago that we have a new child care program, Little Sprouts Daycare in Kiowa County. It's a family child care program that achieved the breastfeeding friendly child care provider designation, bringing the total number up to, I believe, 39 now. So we hope to grow that number. So if you know of any programs, we're happy to help with the application, as is Child Care Aware of Kansas. Thank you.
Very good, very good. And congrats to the new program. That's exciting. Very good. Any other bright spots? If none, please remember that the agenda items and resources are available on the panel share hub point for panel members. And so when Lindsay sends out, she sent out the link for our Zoom sessions, but there's also a link to the SharePoint where that's where you can get all of the resources, agenda items, et cetera, from all of our panel meetings. Our next panel meeting will be September 15th at 9 o'clock. And the Kansas Children's Cabinet and Trust Fund meeting is October 6th from 9 to noon. And both of those meetings are virtual. We are going to go on ahead and take a few-minute break. So that you guys can go get some coffee, run to the restroom, check email, etc. So we have about 10 minutes, and then we will break out into our work groups. So there will be links for you all to be able to move on to your rooms. It is now 9:50, so we'll return at 10 o'clock. And for the first conversation in terms of your work groups. For those of you who are watching, thank you for zooming in and watching us today for our panel meeting. Please look at all of our social media handles and go to the Children's Cabinet YouTube page for recordings of this and all of our previous meetings as well. So thank you all again for joining us. I hope you all have a wonderful day. Please stay cool. We have a heat wave coming through this weekend apparently. So, stay cool if possible. So panel members, we will see you in 10 minutes.